Hi, Dr. Hyde?
So what seems to be the problem today?
Well, I just came in for a checkup and a dental cleaning.
Open up and let's take a look.
Okay,
Wow, I've never seen one like this before. Let me try this. Well, besides a lot of plaque buildup, there's a major cavity in one of your wisdom teeth.
I feel it.
Hasn't this given you any trouble?
Well, the tooth has been bothering me, and it sometimes hurts when I drink something cold. Does it look that bad?
Well, we're going to have to remove the decay, and then we'll either put in a filling, or if the decay is extensive, we can't repair it. We might have to put in a crown on your tooth, or as a last resort, we'll have to extract the tooth.
Well, that sounds painful.
Don't worry. I've done this once before.
Huh?
Nah, just relax.
Wait, aren't you supposed to give me something to dull the pain?
Chicken. Oh, yeah, I almost forgot. We can either use local anesthetic or nitrous oxide.
Oh.
Laughing gas.
Oh.
To minimize the discomfort you might feel. Or you can just grin and bear it.
No. Put me under.
Yeah,
I can't
thought
stand
so.
pain, and I'd rather not be aware of what's going on. And if I need a filling, can I get one that looks like my other teeth?
If we can save the tooth with the filling, I recommend the high-strength silver alloy filling instead of the porcelain one. It'll probably last a lot longer.
Oh, okay. Well, whatever. Let's get it over with.
Okay. Pleasant dreams. Drill, please.